Have you ever heard of a heart condition that's triggered by severe emotional stress, such as a sudden, intense bout of fear or grief? This is called Takotsubo syndrome. Now, you might be wondering, what exactly is this Takotsubo syndrome? Well, let's unravel this medical mystery together. Takotsubo syndrome, also known as broken heart syndrome, is an intriguing disorder that temporarily weakens your heart muscles. Imagine your heart being so affected by your emotions that it starts to mimic a heart attack. It's a phenomenon that blurs the lines between our emotional and physical health. This syndrome often strikes out of the blue, leaving the affected individual with symptoms that are eerily similar to a heart attack. But unlike a heart attack, this condition is typically reversible, with the heart returning to its normal function after a short period of time. Stay tuned as we delve into the symptoms, causes, and treatment of this fascinating medical condition. First off, let's explore the symptoms of this intriguing heart condition. Takotsubo syndrome, also known as broken heart syndrome, is a fascinating condition that often presents in a way similar to a heart attack. However, it's not your typical heart disease. One of the most common symptoms of this condition is chest pain. This isn't a dull, lingering pain, but rather a sudden, acute chest discomfort that can be quite alarming. It's not unusual for individuals experiencing this condition to believe they are having a heart attack, and indeed, many cases are initially diagnosed as such. Shortness of breath is another common symptom of Takotsubo syndrome. This can occur at rest or during physical exertion. Some individuals may experience this symptom even before the onset of chest pain. The breathlessness can be so severe that it feels as though you've just run a marathon, even though you may have been sitting still. Other symptoms can range from nausea and vomiting to lightheadedness or fainting. Some people may also experience palpitations, a sensation of rapid, fluttering, or pounding heartbeats. It's also worth noting that the symptoms of Takotsubo syndrome can vary from person to person and are influenced by the individual's overall health status and the severity of the stress-triggering event. One of the most distinctive aspects of Takotsubo syndrome is the suddenness of its onset. The symptoms often appear abruptly, typically following a period of intense emotional or physical stress. This could be anything from learning of the death of a loved one to experiencing a significant physical trauma or illness. The sudden and severe nature of the symptoms is one of the reasons why Takotsubo syndrome is often mistaken for a heart attack. However, unlike a heart attack, there's usually no blockage of the coronary arteries in Takotsubo syndrome. Instead, the heart's reaction to a surge of stress hormones causes the symptoms. Now that we understand the symptoms, let's delve into the causes of Takotsubo syndrome. What exactly causes a person to develop Takotsubo syndrome? It's an intriguing question that has stumped researchers for years. While the exact cause of Takotsubo syndrome is still under investigation, the prevailing theory links it to severe emotional or physical stress. Imagine you're faced with a sudden, shocking event, a loved one's death, a natural disaster, or even a surprise party. Your body responds by flooding your system with stress hormones like adrenaline. Normally, these hormones prepare your body for a fight or flight response, increasing heart rate and blood pressure. But in the case of Takotsubo syndrome, this flood of hormones seems to have a different effect. It's believed that this surge of adrenaline might temporarily stun the heart, preventing the left ventricle from pumping effectively. The result? A weakening of the heart muscle that leads to severe but usually temporary heart failure. This phenomenon is what gives Takotsubo syndrome its other name, broken heart syndrome. But why does this happen to some people and not others? That's another puzzle. Researchers are investigating whether genetics or other factors might make certain individuals more susceptible to the effects of adrenaline on the heart. Another angle being explored is the role of sex hormones. Takotsubo syndrome is far more common in postmenopausal women, suggesting that the decline in estrogen levels could somehow make the heart more vulnerable to stress hormones. It's also worth noting that while emotional stress is the most commonly identified trigger, Takotsubo syndrome can also be precipitated by major physical stressors such as surgery, serious illness, or even a severe asthma attack. Understanding the causes of Takotsubo syndrome is a complex task, and there's still much to learn. But with each new piece of the puzzle that researchers uncover, we move a step closer to better prevention, diagnosis, and treatment strategies for this fascinating condition. Now that we have a better understanding of the causes, let's explore how healthcare professionals treat Takotsubo syndrome. Having talked about the causes and symptoms of Takotsubo syndrome, you might be wondering, how do doctors diagnose this condition? Well, buckle up as we dive into the world of diagnostics. Diagnosis of Takotsubo syndrome can be quite challenging, as its symptoms often mimic that of a heart attack. Initial suspicion might arise based on the patient's history, especially if there's a recent history of severe emotional or physical stress. A physical examination might reveal signs of heart failure, but the real game changer in diagnosing Takotsubo syndrome is the use of certain diagnostic tools. Let's start with the electrocardiogram, or EKG. An EKG, which records the electrical signals in your heart, is often the first test done to diagnose heart conditions. In Takotsubo syndrome, the EKG may show abnormal results that can mimic those seen in a heart attack. However, these changes in the EKG are often more dramatic than would be expected given the level of blockage in the heart's arteries. Another key tool in diagnosing Takotsubo syndrome is an echocardiogram, which uses sound waves to create detailed images of your heart's structure and function. In cases of Takotsubo syndrome, the echocardiogram will typically show an unusual pattern of heart contraction, particularly the ballooning of the left ventricle. Blood tests can also be useful. Patients with Takotsubo syndrome often have elevated levels of cardiac enzymes that suggest heart damage. However, these levels are usually lower than in patients who've had a heart attack. Lastly, a coronary angiogram, which visualizes the coronary arteries, can help distinguish Takotsubo syndrome from a heart attack. In Takotsubo syndrome, this test often shows no significant blockages that would cause a heart attack. Diagnosing Takotsubo syndrome is a careful process of elimination and interpretation of various test results. It's a fascinating medical detective story, one that continues to reveal new insights into this unique condition. With the diagnosis clear, let's now look at how this condition is treated. So, how do healthcare professionals approach treating Takotsubo syndrome? Well, let's dive right in. The primary goal in treating Takotsubo syndrome is to manage the acute symptoms and stabilize the patient's condition. This typically involves hospitalization, where healthcare professionals can closely monitor the patient's heart function. Now, let's talk about medications. The use of drugs like beta blockers and ACE inhibitors is usually a key part of the treatment plan. Beta blockers, such as metoprolol, are used to reduce the heart's workload and lower blood pressure. They essentially help the heart to relax and heal. ACE inhibitors, like lisinopril, on the other hand, are used to prevent or treat heart failure and to protect the heart after a heart attack. But treatment doesn't end with medication. In fact, managing stress is a vital part of treating Takotsubo syndrome. Why? Because the condition is often triggered by severe emotional or physical stress. So, learning techniques to manage stress, such as through mindfulness, meditation, or yoga, can be beneficial. In some cases, healthcare professionals may recommend cardiac rehabilitation. This is a program designed to improve cardiovascular health through exercise training, heart disease education, and stress management. Moreover, it's worth mentioning that the treatment of Takotsubo syndrome is largely supportive. This means that the treatment focuses on relieving symptoms and preventing complications rather than curing the disease itself. This is because the condition often resolves on its own with time and proper care. Lastly, it's important to note that every patient is unique, so treatment plans are tailored to each individual's needs based on factors such as their age, overall health, and severity of symptoms. As you can see, the treatment of Takotsubo syndrome involves both medication and lifestyle changes. It's not just about taking pills, but also about making holistic adjustments to one's lifestyle. The key is to manage stress effectively and to nurture heart health. Let's summarize what we have learned about Takotsubo syndrome. This fascinating condition, also known as broken heart syndrome, mimics the symptoms of a heart attack, but is a completely separate entity. It's a temporary heart condition often brought on by intense emotional or physical stress. We've learned that its symptoms are similar to those of a heart attack, including chest pain, shortness of breath, and lightheadedness. However, unlike a heart attack, Takotsubo syndrome doesn't involve any blockages in the heart's arteries. Instead, part of the heart temporarily enlarges and doesn't pump well, while the rest of the heart functions normally or even with more forceful contractions. We've also discussed the causes of Takotsubo syndrome. It's often triggered by severe stress, such as the death of a loved one, a serious physical illness, or a major accident. Your body responds to this stress by releasing a surge of hormones that can stun the heart, leading to the characteristic changes seen in Takotsubo syndrome. Regarding treatment, it's important to remember that Takotsubo syndrome requires prompt medical attention, just like a heart attack. Once other conditions are ruled out, treatment typically involves medications to reduce the workload on the heart and manage any complications. The good news is that most people recover fully within a few weeks with proper care. Understanding Takotsubo syndrome is particularly important for healthcare professionals. It's a reminder that not every patient presenting with chest pain has coronary artery disease. It underscores the profound impact stress can have on our physical health. And it highlights the importance of a holistic approach to patient care, taking into account both physical and emotional well-being. Remember, while Takotsubo syndrome is a temporary condition, it's crucial to recognize the symptoms and seek immediate medical attention. Keep in mind, the heart is a sensitive organ, and emotional well-being is just as important for heart health as physical fitness.